across the world, access to quality healthcare has always been an important issue. Most of the countries have solved it by creating a very viable insurance product, which is also tax deductible. And in India, we too need to do this. We have to keep in mind two things. One is that inflation has really pushed the costs up. In terms of medical inflation, it's about 4.5%. But if you look at people inflation, it's about 8.5%. So therefore, my request to the government is to look at the deductions on health insurance. We have currently, there is a deduction of 25,000. My request is that they make it 25,000 for each individual, so they will get meaningful coverage, and 1 lakh for geriatrics, for people over 60. With this, it will look after their healthcare needs for the short term, at least. I would think that the second thing is preventive health. And this is what COVID has taught us, that people who had looked after their health actually recovered much faster and did not feel the impact of COVID as much as those who are not in the ideal state of health. So in the space of prevention, I think deductions are very, very important. And deductions as well as outpatient usage of diagnostics. These are two areas that have not been covered. Even private insurance has not covered outpatient insurance and use of diagnostics. So we must encourage people to stay well. And the way to do that is to really increase the deduction to about 50,000 rupees for a family for preventive healthcare alone and use of diagnostics within the healthcare system to make sure that they remain healthy. So I think with these 2 points being addressed, we will look after the well-being of patients. Having said that, we recognize that there is a huge shortage of beds in the country. For us to serve the Ayushman Bharat patients itself, there is a shortage of 1.6 lakh beds. Leave Ayushman Bharat, the people who can afford care, there itself there is a shortage. We need to build about 100,000 beds. And the private healthcare system is keen to do that, but it cannot do so in the short frame of time that we need to do so. So to improve that, I request the government to look at the GST on REITs. So there is a leakage of about 18% rentals on property that is inherent in a REIT, which is used by a hospital player. So we really need to look at that 18% so we can rationalize and make the REITs more effective. Healthcare REITs are prevalent all across the world. The entire healthcare system of the US is built around a business case where the real estate is owned by a REIT. And I truly believe that for India to grow the infrastructure, the healthcare infrastructure, we need to have a very logical case for how the REITs and the GST is structured. Otherwise, there's not even a single example for me to quote at this time. Moving on, I think the fourth area is skilling. So the government has really done some work with skilling, where they've given grants to people who are institutions that are engaged in skilling activities. But there is so much more that we need to do. I think what we need to do is to sit together to see what more can be done. So here is how the landscape looks like. India needs a huge population of doctors. We need to improve and increase the number of medical colleges or double the capacity by just enabling them to do more courses. India needs to have paramedics. It needs the whole healthcare system needs that manpower. So I request that the government has a dialogue with the private sector so that we can improve the skilling programs in the country with some incentive being given to the private sector so they can even supply to government hospitals, both the private sector and the government hospitals. The second opportunity is really in skilling, global manpower skilling. And India has the population. We do have the world's youngest population. Let us educate them so that they can provide skilling to the rest of the world. This is something that we have looked at very closely. It's very possible to do. If you look at the cases of Indian nurses going abroad, Indian doctors going abroad, a majority of the healthcare system of the US is served by Indian doctors. Indian nurses, of course, are all over the Middle East. So with attrition rates of 30%, I think it's time that we focused on a very important part of the problem that exists in this country with regard to manpower, skilled manpower in the healthcare space. Having said that, I think that many times I've come on TV just to talk about GST. Currently, for healthcare, we are at 0 rating. The finance minister very kindly allowed a 5% GST on vaccines. And I think the logic for that was very sound. So our request is, we should do a 5% because there is no set off against the input costs. And these are going as high as 18%, which is making healthcare more expensive. And the proof of, if you look at medical inflation, it's about at Apollo, it's about 4.5% just for the cost of consumables, but it is 8% for manpower, minimum rate of 8%. And these people truly deserve these increments that they get because they are the ones who've really rallied around to help us during COVID and continue to do so.